Hey, welcome to the Lesley and Lisa show. Today's hot topic is, what's the dumbest thing you ever did that landed you in the ER?
Plus, we have a word of the day.
And we have a really cool guest.
So stick around.
Welcome to the Lesley and Lisa show.
Hey, welcome to the Lesley and Lisa show, a working title.
Don't have a name yet.
Still, I feel like we're on repeat with that. Anyways, this is our show where we talk about anything and everything because, as always, nothing is off limits. Hi, Lise.
Hi, Les.
How you doing today?
I'm good. How are you?
I'm fantastic.
I feel like I need to match your energy. You have very high energy.
Oh my God. No, you know what? Today's a good day. I started off in the dentist and got my crown set in.
I don't sound like a great way to start a day.
You know what? It makes me, when I get a crown, I feel like a queen. I don't even know why I just said that.
Wow.
All right, listen. Usually we love to kibitz.
Yes.
What did you say? We're going to kibitz quickly?
We're going to have a quick shtick.
A quick shtick.
Yes.
Love it. We'll have a quick shtick, which I feel like we just already did.
Yeah.
We have such a cool guest today, and we're going to have so much to talk with him about.
I seriously can't wait.
Right? So let's move to our first segment of the day, which is our
hot topic.
One of these days we're going to get sued. It'll be fun. It'll mean we've made it.
Yes, exactly.
Can't wait to get sued.
I can't either.
So our hot topic of the day is, what's the craziest, dumbest, or stupidest thing that landed you in the ER? For me,
yeah.
So I'm going to say it was when Izzy was around 3.
Okay.
3 or 4. So that's roughly like 9 years ago. We had gone to a carnival and she got a bunch of little toys, stupid plastic things or whatever. And I was sitting on the floor and I was tying her shoe. So she was standing up and she was playing with this little plastic, I don't know, thingy, whatever, that had like a little, probably Sharpie little arrowy thing on the end, whatever. Okay. All I know is the next thing, she doesn't know, she put it in my ear. She like put it into my ear, and all I know is that all of a sudden it had sounded like a balloon had popped, like psst. I screamed bloody murder because for a moment it was really painful. I heard this hissing sound, and then all of a sudden it was as if the lights had been turned out in my left ear.
Oh,
it was like, and I was like, "Oh my God, what the fuck happened?" I scared the shit out of this poor thing.
You almost said I scared the little shit.
Right? I scared the little shit. Anyways, I go to the long story. I end up at the ER and she popped my eardrum.
That's horrifying.
Crazy though, right? Like, who pops their eardrum?
Does it heal?
Yes. So I eventually had to go see an ENT the next day. And he gave me some drops that I had to do every day for like 6 weeks. And he said, look, she really kind of like, she put a nice little hole in there. So if it doesn't heal, we're going to have to go in and like stitch it up or something like that. But anyways, it healed and all is good. And listen, I can hear perfectly in that ear.
That's great.
Anyways.
I have to tell you, I'm now worried about our guest because I really have a hard time hearing stories like this.
Are you kidding me? This is nothing compared to what he's going to talk about.
I know, so I'm worried. But it's like I freak out about how fragile the human body is and how easy it is to fuck something up like that.
I will tell you that every time I put a Q-tip in my ear, which should be never, but it feels so good. Sometimes I'm in a bad mood. I just literally put a Q-tip in my ear.
Sure, that makes sense.
Yeah. Anyways, but every time I do it, I think about it because
I'm sure.
I recognize how easy it is to pop your eardrum.
And now every time we do it,
you're going to think about it. Everybody's going to think about their eardrum now when they clean their ears.
All right. You want my story?
Yeah.
So so you know in cartoons where somebody steps on a rake and the rake pops up and hits them in the forehead? So I did something similar, only it was like one of those like 3-pronged like hose, like with the really sharp prongs. And I stepped on it and it went through my foot. Like it went through my foot and came out the top of one of my toes.
Do you have a picture of that?
No, because it happened.
Why?
It happened when I was like.
This is a long time ago. Like
this is
the iPhone. Like.
Oh yes, this is like 36 7 years
Oh my
ago.
God, before you were born?
Even before I was born, yeah. And the crazy thing is, because you said really the topic is something stupid you did. So the really stupid part is that I was going to get something out of our kitchen cabinet, and there was
Why was there a hoe in your kitchen?
no. There was a leaf in there that in my brain was a dead baby rat. I don't know why. There'd never been a rat in my house, but that's what I saw. So I ran out front to get out of the house, and the gardeners were there, and I was barefoot, and that's how that happened. So
that is really, mine wasn't really stupid. It was my daughter's fault. That was really stupid.
Mine was really stupid. I like to stay on topic. I have so many stories like that, though, Les. Like, my injuries are always because I was an idiot.
Oh my God, that's fucking crazy.
Yeah. It was
disgusting.
Awesome. And I pulled it out of my foot, which I don't know if you're supposed to do. Okay, let's move on because our guest is in the waiting room.
Pictures, because you know me, I think the grosser it is, the better it is.
You would want to see it?
Yeah, well, I should have been a doctor. Truth be told. I mean, if I was going to really, I needed to be responsible and do something productive with my life, and being a doctor would have been it. But I wasn't just like, I did fine in high school. I actually did well, graduated with honors, but I hated school. I hated having to study out of books. And so, I mean, if you want to be a doctor,
you just said the sentence, I hated that I had to study out of books.
Okay, so here's what I mean by that. That was a really lame way of saying that. But if I had been told I could go to medical school and I could learn hands-on, like I didn't have to read whatever it was out of a book, then I'd have been like, oh, I'm totally in. Let's get into the ER and into the OR right now.
That is hilarious.
I'm like that's the kind of, I'm a student of practice, like
the world.
I am. Anyways, I would have loved to have been a doctor, and now that I'm older and responsible and I have a brain, I look back and think I should have been a doctor. And I know that it's never too late, but let's be honest, I'm 52.
It's way too late.
Okay, good. I'm glad you agree, because everybody says to me, it's never too late. I'm like, I call bullshit.
Certain things it's too late for.
Totally, I agree. Yeah. Okay, so we've almost sort of given away who our guest is, but before we get to that, what's our word of the day?
Word of the day.
Wait, hold on. Word of the day. Okay.
Our word of the day is mask.
Oh, we think we know what the definition is.
We think we do, but I got to tell you, I'm going with the first one that popped up.
Okay.
And it's a covering for all or part of the face worn as a disguise or to amuse or terrify other people.
Oh my God, that's the best thing, because I think everybody in a mask right now is actually, it's not terrifying. It's actually makes me feel good when I see people in a mask.
Same. And that's what I was going to say. I think there's a certain faction of society that thinks that those of us who are wearing masks are doing it to amuse or terrify them.
Totally.
But we are not. We are doing it.
Not. I actually was at Gelson's the other day in the deli department.
Yeah.
They go by number, right? I was 24, but some crazy woman was like, I'm 28, I'm next. And I was like, no, I'm 24. Guy next to me is like, I'm 26. So anyways, so we had to give her a math lesson. And then I looked at her and I was like, what looks different? Oh, she doesn't have a mask on. And I was like, excuse me, miss, you don't have a mask on. You should put a mask on. I was very nice about it.
Yeah.
Because I was not going to brawl in the deli department at Gelson's.
Right.
But ready to if I needed.
Sure, always.
And she was like, oh, she went to get in her pocket to put it on, but yet she didn't have one to put on.
Oh, weird.
So she's in the deli department like this.
People are so stupid.
Whatever.
That's a whole other topic. I could do a whole hot topic about stupid people, which clearly I am one because, I just told you the whole foot story.
No, you're not. But I just saw a fabulous meme about stupid, and I can't remember what it says, so I'm going to pull it up on our next show.
Oh, good. Okay.
We'll go back to that.
All
okay.
Right.
So let's what time is it? Should we just?
I don't know, but.
Too interesting.
Can I tell you something that happened? Because this is so.
It's about what happened to me, of course.
No, it's happening to both of us because our guest was here and now he's gone.
He is?
He left.
Did he have an emergency?
Maybe.
Look at my phone.
Oh my God, what if he did?
Wait, my phone. Well, he's not at work today. Where are you? Oh my God. Now his phone, I think, is probably on airplane. Shoot. Shoot, shoot, shoot.
no.
He's not in the waiting room?
No, he was there and then he was gone.
Is he
You
a
really-
magician?
But you know what's awesome about this? And I just want to say,
Live TV. Now,
No.
live Zoom.
I think you should try to figure this out, and I'm going to see if he emailed, but here's what I'm going to say. Like, you and I are used to working in a way where there are producers and there are things and there's editing and stuff like that. But
Yep.
because of the world right now and because of the medium that we're working in, he's back.
Oh, he's
But-
back. Okay.
But stuff like this happens and we just have to deal with it. This will not
Well,
be edited out. This is
no.
real life. I
Well,
think
here's the greatest thing is
hilarious.
what you and I can do is just talk right through it because,
Right.
which by the way, is exactly why we have the Lesley and Lisa show.
right.
Because we can talk.
About friggin' everything all day long, whether or not it's interesting. Okay, introduce him quickly before he goes away again.
You know what? Our guest, so excited. He is the head of the ER in Tarzana, California at Tarzana Hospital, which is in the Valley of California, or Southern California. So he's the head of the ER. He's an ER doc. So excited to have him here. His name is Dr. Eric Snyder. Bring him in. He's a doctor.
Dr.
Hey, guys.
Eric Snyder, he has to turn on
How are
his
you?
video.
Show us your camera. Show us your handsome self.
Hi.
There he is. Ooh, look at that fancy
Hi.
wallpaper.
Wow.
Don't
Yeah.
mess around in my office.
Hi, Dr. Snyder.
Hello.
Hello, Dr. Snyder. Nice to meet you.
You too.
How you doing?
Oh, absolutely. Well, internet went down as it does almost every day, so it works out well for the kids in their school. So
Oh, no.
Wait, did you say the internet went down?
Yeah.
yeah, that's why I couldn't connect. So I'm on my hotspot right now through my phone. So I hope this works.
It's working perfectly. At least you are like, what's the word? Like, you're just like, you know what? We got to rotate. We got to pivot. I'm going to pivot to the hotspot.
You pivoted, but
Yeah, roll
also
with bunches.
I just saw a person like sneaking behind your door and it just looked like it actually looked like a Peter Pan kind of silhouette.
Well, you know what's creepy is, nobody's home right now. And when we bought this house, there was actually a family that had,
Parrot.
and every once in a while
Stop
you
it.
see just random,
You're a bullshitter. I love it.
I really
No,
believe
But
it for a
can I
second.
tell you something? He says it with such sincerity that you're like, oh my God, I believe you.
Yeah.
So you're
It's
the guy.
creepy.
So this is the problem. Like I'm going to be in the ER, God forbid, and I have cancer, but you're going to come in with the whole story just to make me feel good. And you're like, no, I'm not going to tell you you have cancer. I'm going to let somebody else do that.
no, I'll do one of these good news, bad news things. Like, hey, good news is your cholesterol's fine, really great. Bad news is you have cancer throughout your body. You're going to die in the next 30 days. So glass half full,
Glass half full. He's like, go have some French fries and
Right.
a donut,
And
a
eggs.
giant beer.
Oh
Give
my
it up.
God.
How do you
All
do
right.
today? Oh, cholesterol.
Cholesterol. That's all I mean.
Anyways,
I eat
Doc,
eggs every day too.
okay, there's so much to talk to you about. We went through the top of our show so quickly just to get to you. All right, let's talk about the obvious shit, which is clearly we're living in a
Syphilis?
COVID world. How are you
Oh.
doing right now at this moment? 'Cause
I'm
we
doing all right.
numbers are going up, but you speak to that.
Yeah. So look, we gotta have some caution when we talk about COVID. A lot of what you read about in the news is fabricated and embellished. And I say that with a grain of salt. And let me tell you, I can speak for about 600 physicians across Los Angeles. I work for one of the biggest ED staffing groups in Los Angeles. I'm also the director of Providence Cedars, and I know this very well. As we speak right now, we have about 8 patients in the hospital, Tarzana. We're nowhere near capacity. At peak of COVID in March, we had about 30 admitted. So you will see an increase in COVID patients across California and states, but we're also recognizing it sooner and diagnosing more people with it. And so it's hard to say that we're in this crisis right now, because again, the more people you diagnose, the more people you test, the more people you diagnose. And so the numbers will be inflated. You know, you go to Ethiopia, guess how many people are testing there? They have like 0 cases. Why?
Exactly, because nobody's
They
testing.
can't afford the test. They're trying to get fed, you know?
Right. So let me ask you something. Obviously, you and I are friends, so we talk, but would you say, I think you had said this, do you think you saw this, at least in LA, at your hospital, do you think you were seeing this back in November, December 2019?
Yeah. Yeah, we had an interesting flu season where people were coming in with flu-like illnesses and you know, their flu tests were negative, which are not always positive, but there were a number of people that were diagnosed with what's called influenza-like illness. And that means that the flu test is negative, but you have an illness that sort of looks like flu. You know, we weren't really asking about people losing their taste and sense of smell and all that kind of stuff. So we don't know if they had that. And
now it's too late to check for antibodies or anything, obviously, right?
No, it's not too late to test for antibodies. We'd have to call them back, and they're just random people.
Right.
You know, and so we're not going to call back people we saw back in November just to test their antibodies.
Let me ask you, was the people that you might have, the people that you saw back then that you wouldn't have known what you know now, were any of them admitted into the ER for like intense respiratory?
Sure. I mean, every season, every flu season, we have elderly patients that get really sick with the flu. And as a matter of fact, even very young children get sick with the flu, more significantly than COVID. COVID isn't really affecting the young kids, despite what you hear on TV. There are 1 in a million cases of people getting something called Kawasaki-like disease, which has always been around. It's not a new disease. I learned about it 20 years ago in medical school. And so it happens, but it's just very rare.
But we do. So I have heard that it's not affecting kids, but it as badly, but that the kids, if they have it, they're carriers and they can affect their parents and their grandparents and that kind of stuff.
So I'm glad you mentioned that. Anybody can be a carrier. Kids actually transmit it less frequently and less easily than adults do for some reason. Even though they're more careless with their hands and, you know, they're licking the bottom of their shoes and that kind of stuff. They're just, for some reason, whether because of their immune system and how viral exposures occur in these young children, they just don't pass it and transmit it as easily as we do.
Right. So that's what we all hear, that the transmissibility is significantly lower from a child than it is from us adults.
But I'd love to ask you this. So you're saying that it's been exaggerated a bit and maybe it's not as bad or as rampant as we've been led to believe. But having said that, do you encourage people to still take precautions, to wear face coverings, to wash their hands, to use hand sanitizer when they're out and all that stuff?
Absolutely. And the reason is, it's not to protect our age group, it's to protect the vulnerable, right? So we're not doing this for ourselves. You're doing it for the elderly, the frail, the ones that are actually at risk for morbidity and mortality from this disease. I'm not concerned about my kids. I'm not concerned about my wife. I'm not concerned about me or you guys. It's the people in the nursing homes, the people on dialysis, the people with advanced cancer on chemo. These are the ones that are going to have a higher risk. Now, you should also know the treatment has significantly improved.
Oh, how?
Well, I mean, we've got all sorts of new medications. We're using dexamethasone, which could affect remdesivir, which is sort of plus or minus, but it certainly isn't hurting. Regeneron, convalescent plasma, all of these things that we didn't have early on. And what's interesting is if you look at somebody like Nick Cordero, I will say that I was in no part involved in his care and have no access to his medical records. All I know is what I read in the news. And if you read about how he died in the news, he died from blood clots, right? And that's something that we now screen for in every patient with COVID. Every patient gets a blood test, if you're high risk, to look for blood clots. And if you get the blood clots, you treat them. So when Nick Cordero had the disease, he theoretically and presumptively could have lived because he had a complication that we weren't aware of that was associated with this disease.
Right.
And so now we're very aggressive in screening for that and treating it. And you know, you guys have heard of blood clots in the legs. You get a long plane flight. It's very common. But we didn't know the relationship specifically with COVID-19. And
okay, so this actually leads me to another question. So, things that today that we didn't know 7 months ago. So looking forward though, because this is what also makes me nervous. Let's say, someone who gets COVID, recovers, does well, back to normal. But what we don't know are which you can't know, what are the long-term possible side effects of this? Like, that's again, the fear of the unknown. Like, how is this going to affect us?
So that's a really good topic that you brought up, because a lot of people are afraid of this. And the interesting thing is, when you look for something, you're going to find it. And when I say that is, we're looking so closely at COVID and studying this disease. We don't look at the other millions of viruses that we get every year, right? And so maybe this is a common occurrence with the common cold or the other varieties of coronavirus. There's a million viruses out there: rhinovirus, adenovirus, rhinovirus, blah, 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 blah. And we don't look at those because people recover, but we don't look at the long-term effects if you get infected with an adenovirus, right? Maybe they have some similar effects that if you get an MRI of the heart, it'll look a little inflamed, but we never looked at that. And so people just move on with their life. There's actually a term that we use in medicine called VOMIT. It's victim of medical imaging technology. And what that means, Lesley, is let's say I do a screening CT CAT scan on your whole body and looking, take slices of every part of your body. And I find something on your adrenal gland, right? You're going to freak out. The doctor's not going to say, oh, we should just watch it. You would have never known about it. You probably would have died of heart disease or stroke by the age of 90 and died with that inside you. But because you now have the information, you're going to study it. You're going to get a biopsy, more tests. You may have complications from that biopsy. And so this is where, when we do over diagnostics, you find stuff you shouldn't know about.
Right. Well, this is why, sorry, Lisa, I know you want to talk. This is why,
Lesley.
This is why we shouldn't Google what we have.
Right.
We layman's, I really rarely ever Google anything that I have, because I'll find something.
Right. It's always something life-threatening. And
this is why you're not supposed to ever, like, people talk about like, oh, I think I should get a body scan. I think I'm going to have a body scan to see where I'm at. Well, when you're going to find something, don't get a body scan. Just continue forward. Do what you're supposed to. Go ahead, Lisa.
Okay. Right. But just to add on to that, and then I do have a question, but isn't it possible that a body scan, if you weren't going to get it, could find something that is important to have found at that time?
Absolutely.
Yeah.
Yeah, for sure. But for every 10 CAT scans that find something, or that don't find anything important, you might find, 1,000, you might find one. But then of those 1,000, you're going to find what are called incidental OMAs. Just an OMA at the end of it. It's an incidental finding that now you're going to lose sleep over and possibly die from finding it.
Right.
By the way, I love that your acronym is VOMIT.
VOMIT. It's hilarious.
Victim of medical imaging technology.
We just call it VOMIT. Okay, here's my question. I have two questions, actually. One is immunity. Once you've had it, is immunity a real thing? How long does it last? And does it mean you can't get it at all during that time and you can't transmit it during that time? And the second question is, because of everything you've said that about colds and flus and viruses, that they could all be similar to this in terms of what it can do to our body for the long term, should we wear masks from now on when we're sick out in public? I said it.
God damn you, you said the word of the day. Wait, okay, Lisa, pull it on out. Wait, no.
Oh.
Eric, don't you pull anything out.
I don't have it, actually.
Oh, sorry.
Okay, ready?
Yeah.
I mean, just because you said it, listen, it's funny you should mask.
Oh, yeah.
Oh my gosh.
I thought you were
on right now?
Okay.
I feel like I should put on a mask.
Listen, Eric, when you're low budget like Lisa and I, we had to make our own segments on little obstacle
our
sticks.
own signs.
That's
okay,
cute.
so
right,
sorry. Should we? And is immunity a real thing?
Oh my God, what is happening? Is that a Bloody Mary in that cup, by the way? I'm just asking for a friend.
It should be vodka.
She was blowing the thing because it's the word of the day, and I was trying to get you to say it, but then I said it.
You said the word of the day, you ass. All right, go.
Jesus.
Continue
All
on.
right, so I will answer your questions, but I also have a topic that I want to mention after this about coronavirus being a disease of the developed nation and how messed up our priorities are as a developed nation. And I'll mention that later because I was thinking about this morning. But to answer your first question, let me give you an example of how the studies occur and how we misunderstand everything. I'm
Okay.
gonna tell you, you take 2 groups of kids, 20 kids total, 10 groups in each group, or 10 kids in each group. Got it?
Yeah.
You put them on a bicycle. One set of those kids have knee pads. The other kids have nothing. Then you watch them over a year and find out how many kids get significant head injuries. If I told you the kids with the knee pads had no head injuries and the kids without the knee pads had 30% head injuries, what would that tell you about knee pads?
That the kids fall off the bikes and they probably they go to their knees first and it helps them not bounce their head to the asphalt.
Okay.
I would
So
say
as
that
a
wearing protective gear tricks your mind into being more careful.
Okay, I like both of those. But as a consumer, you're going to go out and buy the knee pads because it's going to protect your kid from head injuries, right?
I
Now, what if
probably wouldn't. I'd get him a helmet, but go on.
Right. So, but as a consumer, we're looking at this, and then the knee pad company is going to publish this study and say, look at knee pads prevent head injuries. Now, what if I told you, well, what they didn't also tell you was the kids with the knee pads are also going to be wearing helmets because they're wearing protective gear. But that's not what they're talking about in the study.
Tell you.
No. And so this is very common in medicine. Those are called confounders, right? Even though the study is correct, those with knee pads had fewer head injuries, but they didn't tell you, oh, well, they're also wearing helmets,
Okay.
right? So there's other things that the study wasn't telling you about, and maybe they didn't even do it intentionally, right? Maybe they didn't know they were wearing helmets, but of course, if your kid wears knee pads, chances are he's going to wear a helmet, right? So if you look at the antibody tests and our immunity for coronavirus and COVID, what we're looking at, the objective things that we're looking at in people is antibodies, right? We're trying to test if you have antibodies because historically, we test for antibodies to determine if you are immune to the disease, right?
Right.
But what they found is even people without antibodies still can be immune. So what that tells us is, so if you look at, oh my gosh, you don't have antibodies in a year, then they publish, well, you're not immune. Well, that's not necessarily true because you're just looking for the wrong thing. There's something else in our body that is creating an immunity besides what we're objectively looking for in your blood. So there's something else out there and we're looking at the wrong thing. So to answer your question, nobody knows about the immunity. It could fade. My best guess from everything that's been presented so far is that we will have a long-term immunity. The immunity may wane a little bit, but it's going to be better the second time you get the coronavirus. You either A, won't get it, or B, if you get it, it'll be mild.
Right.
Interesting. Okay.
And by the way, that just it just speaks to the bigger picture, which is, nothing is black and white. Nothing.
Nothing.
Black and white.
But just so you know,
Gotcha.
what I got from that, Dr. Snyder, was that we should be wearing masks and helmets, right? That's what you.
Yes, and knee pads.
And knee pads.
And knee pads.
Yes. Okay. I just want to
All
make
of
sure I
us should be wearing knee
understood.
pads.
Clearly
Okay.
not listening. The knee pads. Jeez.
Okay, wait, let's go. Okay, enough fucking COVID. I mean, I've had enough of it, frankly.
All right.
All right, so Eric has seen some crazy shit in
I don't want to know about any of it.
She freaked
Wait,
out when I
Lesley, wait. You guys made me a promise.
What?
I want to bring up how this it affects disenfranchised people way more
Oh,
than
yeah,
it affects us.
yes.
Sorry, go, yes.
Because
talk
this
about
has
that.
not been mentioned in the news, right? This is
Yeah.
Snyder original thought.
Okay.
Think
Wait.
about
Oh,
it.
I want to have like a little
Wait,
column.
I wish I
Snyder
wish we
original
had
thought.
a thing for that. Snyder original
Snyder
thought.
original thought. Okay.
I think we got to work on that.
We are.
On the theme song for
Can I
my.
just say something right before you go? Here's what we're gonna do. I think Eric should be a regular contributor to the Lesley and Lisa show, and we are gonna have a sign that says Snyder Original Thoughts.
Yes.
Yes.
Under the condition that if it's before noon, we all have a Bloody Mary to celebrate with.
No
Perfect.
problem
We'll
whatsoever.
have shot skis.
Meh,
Sorry.
I'm with the
Oh.
Bloody Marys.
Okay,
I
good.
like Bloody- So
before
listen.
noon. Okay,
So
go.
listen, so this is a virus that as a whole has a 99+% survival rate if you look at the population as a whole, right? Let's travel to Africa, right? They're dealing with tuberculosis, malaria, cholera, E. coli, Ebola. They're dealing with all sorts of stuff that doesn't have a 99% survival rate. But now when you throw this virus that's infecting the whole world, right? And especially the developed nations where we don't have anything that has a, you know, we don't have active, I mean, yeah, we have clusters, but we don't have to deal with tuberculosis and malaria and all these other kind of things. Cholera, those are all undeveloped. We're now going to spend trillions of dollars developing a vaccine to protect you, me, and our privileged countries, where we'll just leave Africa out of it, or Syria, or India, Afghanistan. If you give them an option, I'll infect all of you with coronavirus, and we'll take away your malaria, your Ebola, and tuberculosis. I guarantee you, they'll great. Let it sweep through us, take away but nobody's looking at that. That's why when I say this is a virus that affects, this is all over the news. When's the last time you saw anything about tuberculosis or malaria in Africa? It's an endemic disease that millions of people are dying from. Nobody cares. But God forbid, grandma in a nursing home on dialysis who's had multiple strokes, she dies. All of a sudden, America's up in arms.
So what can be done about that? What can be done? What do we do about that?
Well, you could fix all of that if we put the pressure on our government and the European government and spent the type of money and focus that we did on this virus that has a 99% plus survival rate to fix Africa. We can do it. There's no reason we can't.
Well, so I will, this might be very controversial, but I'm going to say it. You're talking about a country, half of whom doesn't even seem to care about the other half of this country. So they won't do anything to protect this. So if you think that half of the country gives a shit about Africa, that is where I go down a hole of hopelessness and helplessness. And, you know,
you're right. No, that's my point. Nobody cares.
Right.
Especially in this country where we don't care about our fellow citizens.
Correct.
The homeless in LA. We don't care about that. We care about the rich grandma that's being hospitalized and going to die because she's 9,000 years old.
Right.
Do you know how many people come into the hospital that are 110 years old and they want everything done to them? In Canada, you're not allowed to do that. The doctors decide, look, grandma's 99. She hasn't walked in 20 years. We're going to let her peacefully go. We do that with our dogs. We do that with our cats. I put my dog down at my house. I'm not allowed to do that to Lesley. You know, like, God forbid something happens to Lesley or my family.
Sorry, I'm so sorry.
No, because I've thought about it. I've thought about it sometimes, and Lesley pisses me off. I can't do that, you know, and she does piss me off. Right. But I can't do that. You know, I can't do that. I can't treat my family as kindly as my pet.
I agree with that.
His name. Who's the doctor that fights for the ability?
Kevorkian?
Yeah, Kevorkian. Thank you.
Yeah,
well,
but
yeah,
it's just bizarre. That's
I agree with
healthcare. And if you guys ever want to have a tidbit on controversies in medicine, there's so much stuff that the public is fed through pharmaceuticals and then trickle down through doctors and committees that is forced upon us as treating physicians. It'll blow your mind.
Wow.
And I'm not biased. I'm not getting paid by pharma. I know the research and I know what is good and bad for people. And there's so much that we have to do or else we get sued, even though we know it's bad. That's the state of affairs.
It's really scary. And big pharma is so scary, all run by, well, this is when you're like, can we just have the government step out a little? But
it's so much greed.
That'll lead us to politics, et cetera, which.
Wait a minute.
Oh, hey, wait, where's that sign? Shit.
Politics sign?
I got it.
We have a no politics sign.
Oh, there you go. Wow, Lesley?
Yeah,
well,
I know.
Distract people. We're trying to distract people from the real world.
Right?
We've done a terrible job today.
Listen, if we look at everything, if we look at the big picture, we could all just like jump down a hole and never want to come out because we live in a scary fucking world.
Totally.
Weird. But in our own little bubble, okay, Dr. Snyder, tell us some of the crazy shit that comes into the ER. It's crazy.
So look, one thing that you guys have to know about emergency medicine, we're the only specialty that has an unfunded mandate called EMTALA. What that means is any patient that comes into any Medicare contracted hospital, which is every hospital, we are required by law to perform a medical screening evaluation regardless of the ability to pay. And that's actually one of the things I love about being an emergency medicine doctor. I never ask if you have insurance.
Wow.
So people walk in and I will see them regardless of their ability to pay. And actually, as a side, I actually pay about some of these patients. I will pay myself out of my own revenue to support this because they don't pay me and I have to pay malpractice on them. So actually I do charity work for a lot of patients because I'm actually paying them for me to take care of them.
I feel like there's a Grey's Anatomy episode like this.
There should be.
And it's about you. Okay, go
There
ahead.
should be. So look, I've been doing this for a long time. I think I graduated residency in 2008. And so it's 13 years, but I've been a doctor for 17 years. It's really, as an ER doc, you never know what you're going to get, right? You clock in at 6:30 in the morning or 2:30 in the afternoon, and you wait to see who shows up. And that can be anywhere from, most of the time it's belly pain, weakness, chest pain. But when they put stuff like, I don't know, foreign body and rectum, always, you know, it used to be 13 years ago, you walk in and how did that happen? Now it's just like, I don't even want to hear it. I don't want to hear the excuses you're making. You know, a hairspray bottle this big, no way accidentally migrated from your shower into your rectum. It just doesn't happen. Or the favorite is, I don't know, I woke up like that. I was at a party and my belly hurt. Come on, dude.
Oh, no.
I don't care anymore because it's never going to be the truth. You never get the guy that's like, yeah, you know what? I was messing around. I messed up. I love it. I love the open honesty, but it won't happen.
It's so crazy.
If somebody did say
yeah,
that,
I mean,
if somebody just said, listen, I was in the bathroom, I looked at the hairspray bottle and I just thought, can it fit in my ass? Like,
right.
would you?
I saw hearts. Yeah.
Right. I looked at
I mean,
it looked at me. There was an obvious
right.
connection. But
Right.
like, what would be your reaction? Would you shake the guy's hand? Would you be like, dude, it is so awesome to hear somebody come in here and just tell us the truth?
Oh, I do that all the time. When somebody comes in and says, Doc, I just did 3 days of meth and I'm feeling really bad. Thank you for your honesty, right? Now I
So
can
much
take care of
easier
you
to
appropriately.
treat.
Right.
Yeah, absolutely.
Wait, but let me say, so Eric does, for educational purposes, for himself to teach, he does take pictures of some of the things that come into the ER, the body parts, the things that are maimed, certainly not the person
Right,
itself.
of course.
So I have been privy to a couple of those pictures because I've stolen his phone and whatever. Anyways, it really is more of a commentary on the mental illness in this country than anything
really is.
else. Talk about some of the crazy, I mean, like, dude.
So it's not just the mental illness, Lesley, it's the lack of affordable health care and access to care. And I say that because, for example, you may or may not have seen a penis that was gangrenous, right? That means that it was ulcerated, falling off, Lisa. Like one of those you look at and you're, all right, I'm going to pass.
No, it was
Right, I'm going to pass. I don't care how many margaritas I've had, it's not happening. And he had waited so long because he didn't have good health care. He didn't want to come in and get a bill. And by the time
waited so long for what? How does that happen?
he got bit by his boyfriend.
Oh my God.
Yeah, so it was a human bite, which are notoriously bad. And then, you know how when you consent to a procedure, you consent to the, like this, you may die, you may be paralyzed, you may be da-da-da-da-da, but we're going to do this and you'll probably be fine. Well, this guy had to consent to the worst possible scenario. He had to consent to, we're going to remove your penis.
Oh my God.
Like,
did that
yeah,
happen?
Yeah, gone.
No.
Otherwise, it would have traveled up his body, would have died.
No, Lisa, I saw the picture because I'm sick and I love this shit. It was fucking crazy.
Yeah, it was unpleasant.
Eric, I don't ever want to see that picture.
I'm saying as you know.
No. That is so horrifying.
But listen, Lisa, we also get people from literally sent from Mexico with a piece of paper and saying, usually it's Oliveview in Silmar, it's a public hospital, go to Oliveview because we can't take care of you. So they show up, they're uninsured, they're undocumented immigrants. And one guy came in with a basketball-sized tumor hanging off his neck, and his face was tilted this way, you could barely see. This has been occurring for 30 years. He just kept putting it off not because he's stupid. These people aren't stupid.
No.
They work hard and they don't come to the ER with the sniffles. They have jobs, they have other stuff to do, you know?
It's so sad. It breaks my heart. It's something that I don't understand why there isn't Medicare for all in this country. And then if you want privatized insurance,
Right.
by all means, have privatized insurance. I know it's a little political, but
No,
whatever.
I totally agree.
Makes
You
my
know, I
heart
totally
hurt.
agree.
It makes my heart hurt. So, Eric, let me ask you something. Wait, I had a thought, and then all of a sudden
Well, because gangrenous penis, by the way, was the name of my rock band in high school.
You too?
Yeah, you too.
Wow.
Okay, this is so good. I'm telling you, Eric is going to be a regular fixture on this show.
A regular, cheap, unpaid, you get what you pay for.
Dude, we're unpaid
Right.
too. So
You already said you do charity work. This will be more of it.
This will be charity work.
All right.
I did have a question. I can't friggin' remember what it was. Dang it.
Well, that might be a sign that it's time to let Eric
No.
go, because listen, I have 1,000 more questions, and I'm
So do
being
I.
very restrained because I feel like we would love to have you back soon.
Oh, wait, I remember my question.
Okay.
Eric, I do believe, I feel like people are afraid to go to the ER now because
Oh, yeah.
for two reasons. Number one, if you go in, the first thing they're going to look for is COVID. And there are a million other things that you can have. You don't have to just have COVID. And there are a million signs of COVID that can also be other things. So I think
I love that.
right? People are
love
scared
that you
to go to
brought
the
that
ER. Well, because I know somebody who ended up with what do you get when you're bit by a mosquito? It's going blank right now.
Malaria.
No, mosquito, West Nile.
Mosquito bite.
Oh,
Oh,
West
West
Nile.
Nile?
But he ended up in the ER, and of course, they just want to be like, oh, you have COVID. No, you have COVID, 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 COVID. It's like, no, it's just presenting itself with all a similar, side effects as COVID. Anyways.
no,
but
let him answer. He had a revelation while you were talking.
He did.
So I love that you brought that up, because this is my public education, and I want to reach out to the 3 people that are watching this and let them know.
Which would be Lisa, me, and you.
Right.
Okay.
And let them know that you are absolutely right. So there's social isolation and there's medical isolation. Socially isolate, go for it. But medical isolation is putting yourself in danger. If you have, I'll tell you a perfect example. Somebody from our school that I'm not going to mention because it's illegal and it's not appropriate, waited too long to go see the doctor. They ended up with the horrible condition because they're afraid of COVID, where they now are going to have long-term complications from this. And I'm not saying because it's that one person. We are seeing an increased rise of heart attacks, strokes, things that could be treated in the early stages, but because they are afraid to come to the ER, they're putting off their symptoms and not seeking care.
Mm-hmm.
COVID, we are the safest places to be in the ER for COVID. But we have HEPA filters everywhere. Everything is clean. Everybody's wearing. Come to the ER just to get safe, right? If you have a concern, you got to come in. Now, with that aside, Les, we don't talk very often. I just want to follow up. How's that rash that you were treating? Did you tell your partner? Because I just want to know, is the cream working?
By the way, I try not to bother you. There are times where I'm like, something's going on. I should really text Eric. I'm like, nope. I'm waiting, God forbid. I'm waiting for it to be really important. So sometimes, of course, I bug your wife, like the time I shaved off my pinky.
Oh,
Yeah.
What was I doing? What's that thing called?
a mandolin. I don't want to talk about it.
Like, yes, I shaved off part of my pinky. It would not stop bleeding. So I did finally text his wife and be like, can you just ask your husband if it's okay that it's not, seeming to
COVID.
stop.
Right.
Anyways.
I would have said it's COVID.
Right.
Exactly. You have COVID. Just be done.
Yeah.
Well, okay. I can't wait to have you back
You're
because
the best, Dr. Eric Snyder.
the 3
ever.
viewers that we have will always want to tune in.
Yes.
Right?
And if they want like a signed autograph, like swimsuit edition picture,
Yes.
I'll pay them to take it. Just let me know.
You'll pay them.
It's so funny what you could possibly sign. You could have taken that gangrenous penis
Right?
and
I could have wrapped it around a coffee mug
Oh,
and
God.
sold them.
God, I wish
Okay, nice to have you. Thanks for stopping by.
Bye, guys.
one of these days I'm going to have him send that picture to you. Dr. Eric Snyder, you're the best guest ever. Seriously.
Thank you so much.
So much
Bye,
better
guys.
than
Good
any
luck.
actors.
Bye.
Bye.
So much fun.
He's amazing. Let's
Right?
talk about him.
Let's talk about him.
So here's the thing. This has been way too long of a show, so we're going to talk about him quickly. But I do want to say one thing. That was incredible. I genuinely could talk to him for another 3 hours.
My hair's freaking out.
But here's my question, or a statement, and then I want to know what you think. So I heard him. I understand that it's possibly being blown out of proportion. I am still going to continue to be paranoid, afraid, and obscenely careful.
Of course. By the way, I am too. I mean, listen, you know that I have eked out of my bubble a little bit here and there, because there is some risk reward to that.
Sure.
And you've done that a little bit too.
Absolutely.
But yes, of course. I mean, he's the first person that would say, continue to wear your mask, continue to wash your hands, be diligent, be smart.
Yeah.
Don't go out into a big party, whatever.
But maybe don't worry so much, because I think the worrying lowers your immune system, weakens your immune system. And
because it causes stress, and that's cortisol. And so those levels are up. I mean, listen, it's a vicious circle. I will tell you that back in March, when everything went down, he was much more, intense about it, and all the things, because he was at the ER seriously, like just a little less than 24 hours a day. And he was very serious about it. And the more time that went on, he relaxed, because he's like, okay, I don't think this is as bad as it's being made out to see. But I mean, listen, it's not to ignore what's going on, but very interesting and provocative what he raised, like what the thoughts he raises about Africa and everything that they go through.
100%.
It's thought provocating, that's for sure.
Yeah.
Anyways, this has been an amazing show. Probably one of my faves.
I totally agree.
Right? No offense to anybody else.
No, this is just incredibly interesting. And I think something we're all very interested in. And if you are enjoying our show, please subscribe, like our videos, become a part of our community, comment, tell us what you'd like to see. You want to see more Dr. Snyder? Do you have any questions for us? Because we really want you to stick around so we could stick around. And
perfectly said.
Awesome.
Perfectly stated.
I'll see you next time, Les.
I'll see you next time. I'm pushing the leave button, but like as always, I'm always going to smile some weird smile and then push leave. Ready?
Bye.